Hi, everyone. Welcome. Thank you for joining us today. We are already in week three of our series of dialogues. Let's just give a moment for people to join. Welcome, everyone. Thank you for joining us today. And as we get into the chat and as we get into the session, let's write in the chat, please, our names and which country are we joining from today. So let me also do that here. It is Gonzalez from Mexico, or Mexico, as we say in Spanish. There we go. Okay, so thank you everyone for joining, for being on time. Let's just give a moment because people are still joining from the breakout, from the waiting room. And we will start in just a minute. And as we start, let's also change our names. Remember that it's really important that we will put English and French in our names. So please let's do that, and I will give more instructions in a minute. Okay, so let's start with our session. This is important. In order to be able to listen and to view the presentation in your own preferred language, please select English or French from the interpretation channel in the Zoom, and select English or French screen from the top menu bar on Zoom. We want everyone to be able to understand all of the presentation. So let's please select our preferred language, either if that's English or if that is Zoom. And remember that you will be able to engage with us through the chat. Okay, so let's do that, please. We have a short video. We have a short video for people to see how to rename yourselves. So let's just, it's 10 seconds and you will be able to see how to rename yourself, because we need everyone to put EN if it's English or FR if it's French in your names. So here we go. Okay, so it's really easy. You can select participants, select your name, or you can select directly rename from the small box that has your name. And let's write EN for English and FR for French. So I will just give a moment for people to be able to do this. And we are really good with time, so we can spend a minute doing this. Thank you, everyone, for doing this. Thank you for updating your name. This is a really, really important step, because this will allow us to put you in the right breakout room. Okay. It will allow us to put you in the breakout room Yes. Thank you. It's really easy. It's just to find your name, either in the participants or in the main screen. You click the three dots and you select rename. And you will be able to add EN for English and FR for French.
Okay.
Okay. Okay, so thank you, everyone. And let's continue. So our mission and the things that we are aiming to do is to make vaccines more accessible, to enable innovation, and to expand immunization across the globe. Okay. Every step and every activity that we do has this specific mission in mind. And this is our agenda for today. We'll have our welcome and introductions. We have a short update about the survey, just a reminder about the importance of filling it in. Then we'll have 10 minutes of importance of trust within the climate crisis. And then we'll have 2 breakout rooms. And again, for these breakout rooms to work properly, we need everyone to be able to write EN if you speak English in your names, or FR if you speak French in your names. Then we'll have at the end a short video about this information in the immunization space. And then we'll end our session with key takeaways and next steps. So thank you, everyone. I can see how a lot of people are renaming yourselves. Amazing. This is amazing. Some people still missing, but I'll say most of the group is already. If you are still missing, please select your name, 3 dots, rename, and you will be able to rename yourself. Okay, so just as a reminder, we're in the midpoint. This is the 3rd week out of 5. And we're talking about trust. So who do you trust? That's our checking question for today. And I will ask everyone to be able to write in the chat. Just think about this. Who do you trust? And let's see some of the answers. Let's take a look and we'll be able. Okay, people trust in your friends, people trust in God, people trust in their mom, their dad, their family, their close friends. This is amazing. Thank you. Thank you, everyone, for sharing your thoughts and for helping us reflect on who are we trusting now. Let's keep those answers coming. And thank you, everyone. People trusting their parents, science, God, people of confidence, truth. Okay, amazing. Thank you, everyone, for sharing your thoughts. And let's start now with this framing of how important trust is, especially when we are talking about the climate crisis. So some of you, all of you receive a short video that was a pre-work for today. And in that video, we were able to see and we were able to listen about the importance of trust and the importance of vulnerability. Okay. And one thing that we need to acknowledge, and that's one of the first things that I want to mention here, is that this information in all of our communities has a real impact, okay? Throughout our work, throughout our daily activities, we all can see how this information has a real life impact. And at the same time, another important element that we need to consider is how vulnerability and being open with our communities and with other people allow us to grow trust, to have trust. Now, one thing that is important, and I am curious about your thoughts on this item, is sometimes we can believe and we can think, especially in the immunization space, that if we just use more data, people will be able to trust. But in reality, we don't see that happening. Because sometimes if people are concerned about something, if they have distrust about the topic, just giving them more numbers and just giving them more statistics, that will not solve the problem. That will not solve the distrust. Rather, when we are sharing our stories with them, and when we are able to connect with them, those two elements will allow us to gain their trust. So it's really important that we can see this, because as we go through our activities and as we realize the importance and the impact that this information has in our communities, as we share stories and as we connect with our communities, we will be able to gain trust. I can see, yes, so some new comments in the chat. Thank you for sharing those. And now, when we are talking about trust and when we are discussing about the importance that trust has in our communities, a second element that we also need to acknowledge and that we need to realize is that relationships are the glue that allow us to connect with our communities. And again, as we were saying just a minute ago, when we go throughout a moment of some kind of crisis in our communities, if we are able to have strong relationships and as we are able to connect, connection will be key, okay, to be able to gain the trust of our communities. And I just want us to reflect on this for a moment. When was the last time that we were on our communities and that we were able to connect with someone? And I will invite people to write in the chat. When was the last time that you were in your community and that you were able to feel that connection with someone in your community? Let me take a look at the chat. Okay, people sharing in the chat today. Okay, if people can write in the chat maybe one line or two lines about how that happened, that will be amazing, because that will allow us to see about that. Okay, I can see some comments in the chat. People were able to feel that connection during a community engagement meeting. Okay, people were able to see that connection with their community in a burial of a brother, during a campaign. Okay. Okay, in the last few days. This is amazing. So we can see definitely how people are able to connect, how people are able to feel the importance of those connections, and how trust can be gained and trust can strengthen those those connections. Okay, let's see. During the last immunization campaigns, November 2024. Okay, keep these stories in mind, please. As you are remembering when was the last time that you felt a connection, please keep those moments in your minds, because this will allow you to have specific stories that you will be able to share in the breakout rooms in a few minutes. Okay, I can see some other comments in the chat. Community engagement meeting. It seems that community engagement meetings are a real place, a real moment where people are able to feel connected with their communities. Okay. Perfect. Amazing. Okay, now I have a question for you, because this is also important, and it also connects with our discussions in the breakout rooms. How do people decide with whom they want to build relationships with? And let's write in the chat, please. How do you decide with whom are you connecting in your community? Let's see. Let's in the chat. Let's wait a moment here. Okay. So I see that people say that based on shared values and interests, some people choose who they build a relationship with that in mind. Other people decide with those people that are as leaders of a community. Okay. People that have the same interest. People deciding, sometimes it depends on the circumstances. Okay, let's see what else. Okay. Let's see, community informers, okay. 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 Mutual understanding in function of the objective. Perfect. Okay, so we can see a lot of amazing answers in the chat. So let's keep those coming, and let's reflect for a moment. How are we deciding with whom are we building relationships? With whom are we connecting? Are those people that are part of the community in the same space that we are, some leaders in the community, people that are, let's see, I see a lot of shared interests. I see a lot of shared values in the chat. So thank you for sharing those. And that will be really, really interesting to hear those stories in the breakout rooms. All right. So just as a wrap up before we start moving to the next part of our session today, let's keep in mind the real impact that this information has. Let's also remember how, as we are fighting this disinformation, trust plays a definite role, and connection, sharing our stories, sharing our shared values, sharing our main motivations, those are key elements into going through this process of gaining the trust of our communities. Okay, thank you everyone for sharing, and as I said, let's keep these stories in mind as we go to the breakout rooms. But just before we open the rooms and before we go to the rooms, I would like to ask my colleague Bilal Khan, who has a really short reflection about the survey. We have some amazing responses so far. So Bilal, please.
All right. Thank you, Sam. Hello, everyone. I want to thank all the participants of the dialogue series for taking the time to fill out the survey. I think we have a very encouraging response rate. I think close to 150 people have responded, and we will be going through the full results of the survey um, in the next session, and we will be connecting that to how we can uh, use stories to make the case for change as it relates to more attention towards climate change. But I wanted to share maybe a few highlights from the survey that could be useful. And the first one, which I think is reflective of the situation on the ground, is that floods are the number one extreme climate change event that most of you have observed. Over 80% of the participants chose that as an extreme climate event that they have experienced. And then amongst the top five, other than floods, you have heat waves as the second. Then you have extreme rainfall as the third. Fourth is droughts, and the last is poor air quality. And just want to share that global data does align with what you all have shared. Floods, heat waves, extreme rainfall, and droughts are indeed amongst the top extreme climate events. And what we also noticed from the responses is that more than 80% of you said that extreme climate events are leading to increase in vaccine preventable diseases and their transmission, which also I think is a huge cause for concern for the immunization community, and needs to be dealt with. And to move on, I think the most important piece of this is that more than 80% of you have said that you do not have adequate resources to overcome the challenges posed by extreme climate events. And that really, I think this session is about trust. And, this raises the question, like, if people don't have the adequate resources, how will they respond? And what will that mean for trust, both within immunization professionals and the community that they serve? And not surprisingly, 80% of you do say that this has made your ability to reach children much harder, and it has negatively affected you as well. So I will just pause here and give this to you as some data points to think about as you delve into the breakout sessions on trust. And hopefully we will discuss these survey results in more detail in the next session. Thank you.
Thank you, Bilal. And let me share again my slides.
Okay. Bye, Sam. Bye, Pedja.
Hello, Dr. Thank you for joining us, and let's recall. Let's try to keep our microphones in mute. And let's try to keep our microphone in mute so that we don't get distracted by background noises. Okay, let me share again my screen. Okay, so we are getting ready for the breakout rooms. And before we go to the breakout rooms, I want just to ask again, people, let's spend 1 minute doing this because this is really important. We need everyone to rename yourself. Okay, I see a lot of people have renamed themselves in the chat, in the participant list. Still, some people are missing. So let's just spend one more minute in this because this is really important, and that this will allow us to have everyone in the right space, in the right room. So I will say,
there's someone asking a question, raising a hand, Dr. Muhammad, I think.
oh yeah, Dr. Muhammad, please open your microphone. Yes.
Yes, thank you, Sam. In fact, I just wanted to know that your screen is showing the French, but like I don't know why. But yeah, so but I didn't select anything. Usually didn't select anything, and
Okay.
all our meeting is in English. So,
Okay. So
yeah, please.
right, Dr. Mohammed, right now, can you see my screen?
Still in French.
Okay. If you check the upper part of the Zoom window, there should be two tabs. One says English and one says French.
Okay, I will change to into English. Okay. That's
Thank
great.
you.
Okay, done.
You are welcome. Okay. And I can see, thank you. I see more people changing their names, updating their names. So we will be opening the breakout rooms in just a minute. And I would like to ask people just to be aware that you will probably receive an option to join the room. So just click that, join, and you will be taken directly to your room. Let's see. These are some basic instructions, really important instructions about joining the breakout rooms. Our champions will share who the note taker is. And then they will hit the record button because we are trying to record every single element of your stories and of your experiences. And there will be some prompt questions. So the prompt question for the first breakout room is, what are you doing to build trust within your community? Okay, what are you doing to build trust within your community? And your champions will be leading this conversation. So please, let's join the rooms and start discussing. You have 15 minutes for this part of the conversation.
Hi, Ed, please take this device to room 4. Thank you.
Sure, just give me a moment, Marta.
I think some of them are in the wrong room. I'm adjusting.
Okay. So yeah, let's some people may be
French room. That's why I want to need the change in my room.
okay. Don't worry. We will be making adjustments for everyone to be able to be in the right room. Please bear with us for a moment.
Sam, it looks like there are 2 champions in the room I am. I'm with Ahmad.
Yes, if some people are in the same room, Marta, let's not worry about that. Let's just continue with the conversation, and let's keep going. Don't worry.
Okay.
Thank you.
I'm still waiting to get to room 4 with my second device.
Okay, I'm trying to find your second device. Give me a moment. Okay, let's see. Okay. Here in this main room to raise their virtual hand. Please select raise your virtual hand. Let's have 3-4 voices. So if people want to share about the question in the screen, what are you doing to build trust within your community? And I see, okay, I see some hands being raised. And let's see, Madame Corinne.
Oui, merci. J'ai
You
été
sh-
le rapporteur de ma salle de réunion.
Mhm.
Et pour la question de savoir que faire pour instaurer la confiance dans votre communauté, nous avons déjà, pour la première étape, connaître le problème des populations. Aussi, apporter cette population à prendre connaissance des risques auxquels ils sont exposés afin de leur faire un récit, donc de raconter une histoire, se baser là-dessus pour raconter une histoire, afin de les emmener, de les introduire dans notre démarche pour atteindre notre objectif. C'est un peu le résumé de la question. Merci.
Merci. Melanie.
Thank you so much. I wanted to share on what we do at our level. So we have incorporated a digital platform that is called Dr. Smart. And in this way, we are able to communicate with our CEOs and doctors in the rural areas. For example, if I am in the city that is Nairobi, I'm able to consult with a doctor in Homa Bay Health Center or a rural place via an app. And maybe if they have a patient that requires a male person or requires a Muslim and they are not a Muslim, or maybe they just require an external voice, just to clarify or to add on to something, or to just, to enhance what the healthcare worker has said. So they are able to do that through the app, through a camera which is able to see me in Nairobi and see them also. So we are able to talk, and the doctor is also there, and the mother and the daughter of the child is also there. So it builds a trust, and we have seen it work. And in case they need any other info, we also give them info from the contact from a doctor who is not there within the rural place, but they can always call whenever they need an answer whenever they have a question or something. So we have seen it work, and yes, that is what I wanted to share. Thank you.
Thank you, Melanie. And it's really interesting to see how technology can also support us to build this trust within the communities. So thank you for that.
Thank you.
Hamado.
Oui, merci beaucoup pour cet intérêt. Je crois que les discussions ont été très riches en termes de répondre à la question. Donc, ce qu'on retient en gros, il est suggéré pour être proche de la communauté, d'avoir la confiance, chercher à avoir la confiance de la communauté, en particulier des leaders communautaires, pour pouvoir, au besoin, faire passer son message. Ça, c'est un premier point. Le deuxième point, il faut mettre l'accent sur la communication. La communication pour écouter toutes les parties et qui auront confiance en vous pour exprimer leurs désirs, leurs besoins sur lesquels vous allez travailler pour pouvoir les aider aux besoins. Et il y a une autre suggestion, c'est avoir une attitude empathique devant la communauté. Il faut montrer que vous êtes avec eux, vous êtes sensible à leurs problèmes et que vous êtes ensemble pour trouver des solutions aux problèmes posés. Voilà ce qu'on retient en gros.
Merci, Amado. And yeah, definitely also apathy in the community it's a contributing factor. Thank you for sharing. Then Juma, please share with us.
Thank you, Sam, and thank you, my colleagues. Actually, I would like to add, even though the feedback from our group has been shared on the chat box, but I would like to add from it. You know, one of the strategies that we do, what I do in my local community, is to ensure proper community engagement, where I align myself with my community, where they will feel me, I will feel them, they will feel I'm part and parcel of them. And by that, I'm gaining trust from my immediate community where I serve. Then also, I try to incorporate some individuals, some stakeholders that have interest in whatever services I'm rendering. Partnership is very vital in order to gain trust, because if you are giving services that is outside the interest of that community, they will see you as an alien, as not part of them. And by that, we are not going to gain any trust. So in our public health services, we try to align ourselves with these major stakeholders that we can partner together in getting services to them. Then aside from that, you know, persistency is another key factor to gain trust in any community that you are serving. Whenever you are giving services or you are making yourself consistent, persistent in whatever thing you are doing, you tend to gain the trust from that community that whatever thing you are doing, there is no failure in it. And by that, we excel in community we find ourselves. Thank you, and over, Sam.
Thank you, Juma, for sharing. And I see some amazing comments in the chat. So I would just make a pause here for reading some of the comments in the chat. We can see that in some breakout rooms, one key factor was being able to identify the needs of the community, and that allowed people to build trust in a better way. Active listening definitely, that's also an important step to be able to build trust within the community. Some other comments in the chat are using communication with the parties involved. The training of workers also helps build trust. Thank you everyone for sharing in the chat. And I see still some hands up. So let's John Akesh, can you share, please?
Okay, thank you very much. Just based on the questions, what you are doing to build trust within the community. So based on that, the most important thing when you want to do any programs within the community, or you want to start any program, so you have to do visibility studies. And the visibility studies you are doing, you have to involve the community. So community engagement is part of it, so that during that initiation of the program, the community will have built that trust in you. And also, secondly, you have to make sure that all the key opinion leaders are involved in these programs where you are doing during the visibility studies. And then you have to don't also make like promises to the community when you cannot fulfill. So that one will definitely break your trust with the community. So avoid empty promises to the community. So that would be also not fine. And then, so this is the major areas that maybe I can just focus on it to say. Thank you very much.
Thank you, John. Thank you. Next, I would like to hear from Colette. Colette?
Oui, merci beaucoup pour la parole. C'est le résultat de notre travaux de groupe. J'ai déjà mis dans le chat que pour avoir la confiance, il faut être proche et gagner la confiance des leaders communautaires. Il faut aussi multiplier les occasions de communiquer avec la communauté. Par exemple, lors d'une consultation consultative, prendre un peu de temps de parler d'un sujet qui impacte la communauté pour vraiment les écouter et donner des solutions. En résumé, ce qu'on a écrit, c'est ça, hein. Et pour le troisième, c'est l'attitude qui compte beaucoup. Il faut avoir une écoute, laisser la personne parler de ses besoins, cerner les problèmes et donner des suggestions, solutions. Merci.
Merci. And yes, listening to our communities and the attitude, as you said, of our communities, those are key, definitely key parts. I have two last people in my screen. So Peter Owiti and Abdi Jamal, and then we need to close to move to the second breakout room. So Peter, and then Jamal, and then we go back to the next breakout room. Peter.
Yeah, thank you very much. What we are doing to build trust within a community is, first, you must be a community member. You must live within the community. And so if there are issues, then you are part of the beneficiaries or part of the consumers of knowledge. Secondly, is that for people who are in the civil society space, we help in deciphering the science. Like in vaccines, you have to explain to the people, how does vaccines give protection? How is it safe? How is it discovered or manufactured? And so you help them to explain the scientific part, which is difficult for them to understand. And sometimes we don't have the right language. So, like in my language, you don't have oxygen as a gas in our language. So you explain to that about different names of gases or different names of elements. And then after getting their buy-ins, then we have a community dialogue. We always encourage community dialogues where they come and also give you their views on and perceptions and practices. And then we become a community of practice. Thank you.
Thank you, Peter. And finally, Abdi Jamal, please, if you can share with us, and we will be moving to the next room.
Thank you so much, Sam. I don't want to spend a lot of time. I know my colleagues have spoken. I just want to touch on something critical, which is called the social media communication. Where I work with refugees and pastoralists, and refugees are very good in terms of education and learning. They want to learn every day. So what I do to build trust in that community is that I identify the opinion leaders, that is the religious leaders. I pick them, and most of them, at least they have knowledge. I train them, and after I train them, I take them to a radio station or a communication channel where they speak out to the community. And all the questions, I record them down, and also I follow up to give feedback and prompt communication. Thank you so much.
Thank you, Abdi. And sorry, Abdi, I want to do a follow-up question, because you talk about your work with people that are in vulnerable conditions. Is that right?
Yes.
So, and I just want to do a follow-up question, because in our previous sessions, we discussed about the importance of working with these groups. And we also talk about some ethical dilemmas that could be presented, and we work with that in our scenario. So could you share with us a little bit more about your experience on building trust within these communities, please?
Yeah, thank you, Sam. Where I work with the vulnerable communities, we do I do tackle the religious leaders, because I find them very critical to them, because these are people who have been moving and migrating from areas of war and all that in Somalia. So what I do is I call the religious leaders. We do talk the same language with them. I'm happy that my colleague who just left us talked about language, and the aspect of understanding is really important, and active listening. So at first I give them the opportunity to speak about an issue, and then after they speak about it, I now share the experience, and also I share my own experience experience again, because when we talk of immunization and vaccination, for example, COVID-19 vaccines, remember during the start of the COVID-19 vaccines, we didn't have female and lactating and the pregnant mothers were not actually the first target. And at some point, the mothers were actually asking, why not us? Why the other groups? So we were able actually to figure out, and through the research and information that we have, the knowledge that we have, we are able to cascade it into the religious leaders. And these people are really critical in every community because they have the mouth and the speaker to the community. When they speak, people follow them immediately. So that is my experience on my side. Thank you so much.
Thank you. No, thank you so much for sharing that. And thank you everyone for sharing, because we could see that there were some amazing conversations happening in those breakout rooms, and that language was not a barrier to understand and to share with each other. Okay, so before we move,
this is Pedro. Can I make one comment?
Sure.
Like, when we were designing this session, we had a feeling that in this room there's a lot of knowledge how to build trust with the community, and we just witnessed that, like, across the board, that people actually have a lot of experience how to do that. And I hope by sharing with each other, you got an inspiration what else you can do in this domain. And thanks everybody for amazing contributions here.
yes, thank you. Okay, now as we move to the second breakout room, I want to spend a minute talking about the second prompt question. So let's just, okay, this is our second prompt question for the new breakout room that we are going to start in a moment. And I want everyone to reflect on this question. What is the additional support that you need to continue trusting in the system during the climate-related events? Because we all know that in the middle of a crisis, in the middle of a climate-related event, there is a lot of stress, there is a lot of fear, sometimes even mistrust can happen. And we, as we were preparing this second question for the second breakout room, we were reflecting on that. And we know that you as immunization professionals will probably have these same questions about what's my relationship with the system here in my community, in my state, in my city, in my country. And one question that we have is, first, are people having these trust issues with the systems? And if so, what are those support? What is that support that people may need so that they can continue trusting, okay, in the middle of these events? And our breakout rooms are almost ready. So before opening them, I would like to ask my friend and colleague Peja, if you want to add anything else, Peja, before we move on to the breakout rooms.
Yeah, no, this is a really important question, because it is now not about how do you build trust with communities. We know that there's a lot of wisdom and knowledge about that. This is about, as immunization professionals, as healthcare professionals, what do we need to trust the system in the moments of climate and crisis? Because somehow we always forget about ourselves, but we also need certain things in order to have trust in a system, especially when things are tough. And as we witness, as Bilal shared with us, like, let's take, for example, floods. Like, during floods, things are hectic. Like, there's so many moving parts. Like, immunization is interrupted. Like, we've heard so many stories from people. So in those moments, if you personally don't trust the system, it's hard to imagine that you can pass on the trust to the communities that you're part of. So we want to examine that a little bit, like to talk about what do we need as immunization professionals to actually trust the system in the moment of climate or weather events or climate crisis or certain moments that you've already experienced or that you might experience in the future. So it's a little flip not about the community trust, it's about our trust. And what do we need to trust the system?
Perfect. Thank you, Peja. Okay, breakout rooms are ready. So we will open them now and see you in a few minutes.
Close them?
I just closed them.
Okay.
I can't do my work. My mom. What?
Ok, c'est dans la français.
How was the room, Peja?
It was great. There was some great conversations. There was also like people were struggling a little bit with the question as well. Like, so maybe it's worth addressing, you know, that in some groups, like it was, yeah, because it's a hard question. It's not an easy.
Okay, Peja, sorry. We need to take a decision. I will take a decision about the video because the video is 15 minutes long. So either I have a short debrief or a longer debrief and sending the video by mail.
I think we should watch the video because it's important. So let's do a short debrief and then, yeah.
Okay. Welcome back, everyone. Welcome back. Thank you for joining. Welcome back. Okay, so I heard that there were some really good conversations in the rooms. So I would like to, for the sake of time, I would like to ask two champions to share their experience in the rooms. So, Dr. Preddy, could you share with us about your room, please?
Yeah, thank you, Sam. So our room, I think, like we had a great conversation. I'll start with one interesting point that Sohini shared was innovation. So we have to be innovative in our thought process that like there has to be a lot of research that is required so that we understand why there is mistrust, first of all, and like being more proactive rather than being, you know, sort of reactive to the situation whenever there is a climate related event. And then Anwar also shared that again, sort of elaborating the reasons for mistrust that will help us, that will sort of lead us to the exact resources that we need. Rather than thinking about the resources, we need to find the reasons behind those trust issues. And participation of the community, again, it was like the core of everything. More participation, more conversations, their engagement will automatically build the trust. So those are like very like soft skills, but sort of very difficult to, you know, like bring into the interventions. Then one thing that was very interesting was strengthening the emergency response system. That I think there are a lot of countries and a lot of regions wherein the emergency response system, if they are sort of strengthened and the systems are in place, it will automatically build a trust in the community, and the community's participation will also be, I would say, more than ever. So yeah, sort of I've summarized it, hopefully. Yeah.
Thank you, Preddy. And I would like to ask Rita, if you could also share with us a reflection from your room, please, Rita, in French.
Oui, sûrement. C'était vraiment une discussion très énergique. En fait, nous avons pu relever plusieurs points depuis la tête du gouvernement et comment l'impliquer pour avoir plus de confiance dans le système de santé, parce qu'il y a toujours un manque de cette confiance. Les gens ne mettent pas leurs promesses en action. Ils promettent, mais ils ne réalisent pas. En plus, il y a aussi dans cet engagement politique la collaboration avec les autorités locales et surtout les autorités traditionnelles. Et c'était vraiment intéressant de voir qu'il faut investir dans les infrastructures aussi pour devenir résiliente. On ne peut plus bâtir dans ce temps, comme on bâtissait auparavant, des structures qui ne sont pas résilientes et surtout être prêt pour les catastrophes et avoir un système de reporting, comment rapporter pour éviter que les choses se font de nouveau. C'était vraiment très instructif.
Merci, Rita. Thank you, everyone. And please, if you have some extra reflections, please share them in the chat, because I'm sure there were amazing conversations, amazing discussions. So please, if you have another reflection, share in the chat. We are now moving to the last part of this session, which is a video about disinformation in immunization. And this video was prepared by the Boost team that was specifically with disinformation. Let me just make sure that the sound is properly working. Yes. And let's watch and pay attention to this video.
Good day, everybody. My name is Kate Hopkins. I'm Sabin's Director of Research for the Vaccine Acceptance and Delivery Initiative, and it's my pleasure to be speaking with you today about the consequences of mis and disinformation. Let me advance the slide. Okay, so today I will be going through some term definitions, as well as the problem, the how, who, what, and why of the problem, talk about some solutions, and then summarize a few key takeaways. So starting off with definitions, research on misinformation has grown in volume and scope in recent years, but defining misinformation in a consistent and coherent way has been a challenge. These are a few of the definitions that I find are best suited to the actual term. And these terms fall along a continuum from falseness to intent to harm. So misinformation is on one end of the spectrum, and it's unintentional mistakes such as inaccurate photo captions, dates, statistics, translations, or when satire is taken seriously. And then that moves to the opposite end of the spectrum, which where there's intent to harm, and that's where malinformation resides. And that's the deliberate publication of private information or for personal or corporate rather than public interest, and is done so often for revenge. There's deliberate change of context, date, or time of genuine content. And then somewhere in the middle is where you find disinformation, and that's fabricated or deliberately manipulated audio or visual content, intentionally created conspiracy theories or rumors. To dig into the misinformation versus disinformation a little bit more, the best way to summarize that is that misinformation is information that is false or misleading, but may not be known to be so by those who create or spread it. Whereas disinformation is false or misleading and is known to be so by those who create or spread it. And mis and disinformation is a more common problem than fake news. And the definition of fake news is a catch-all term often used to dismiss accurate information inconvenient for those in authority. And the aim is to damage its opposers. So when you look at all the definitions, if you're getting confused about which term fits what definition, look at the definition and it sets out who or what defines it as wrong. It also addresses the intent. So if the intent is to harm, that's more malinformation and disinformation, and unknowingness could be misinformation. These definitions also recognize that information's accuracy changes over time, and it recognizes that information is not strictly false, but it may mislead an audience. So it's not entirely true. So how does misinformation mislead? In a variety of ways. It can be misleading or through an unproven claim. It can omit all of the facts, which would make understanding that piece of information a little bit clearer or come to a different conclusion. It can include overstated or understated claims, which is an exaggeration or manipulation of facts. And it can be fabricated or mislabeled content. And setting out the way in which misinformation misleads makes corrective information more effective. So for example, you're going down this path and you're presented with some information. The first two riders encounter misinformation and end up on a completely different path altogether. Whereas the third one received the facts and course corrected. So who and what drives misinformation? There's three different buckets of who. Known individuals and organizations. These are often in the public eye, academic individuals and experts, business leaders, celebrities, politicians. The second bucket is lesser known but still identifiable. These can be community influencers or famous conspiracy theorists, again, local political activists. And then the third group is the more unknown individuals and groups. So those typically hide behind your electronics, your computer screens, community networks spreading myths, hoaxers and scammers, or other unidentified individuals or organizations online. There's also impersonal factors that kind of affect and drive misinformation. So that can also be lack of access, someone who has lack of access to information. Could also be human error, a mistake in perpetuating misinformation. There could be, people who are incentivized to push misinformation through financial or social gain. And then there's media and political structures that can also drive misinformation. And there's three different categories that are the main drivers of misinformation, and those are competition, fear and uncertainty, and anytime there's a need, want, or interest in something, there's opportunity for mis and disinformation. We've seen this plenty of times before, such as political competition during an election period. During times of, unprecedented events such as the COVID-19 epidemic. There's just a lot of information pushed and people are scared and wary of the new treatments and prevention measures. And then, when there's not, in times of uncertainty or information gathering, there's often speculation, and that's where gossip and rumors and myths propagate. So what are the types and formats and harms of misinformation? The types and formats are vast. I mean, it can be in print, TV, radio, kind of all forms. So this can come in broadcast statements or community perpetuated rumors and myths. It could be official statements in print, fake documents posted on websites, in speeches, voice notes, videos. Basically, anywhere you consume information or news is where misinformation can be. And what are the harms? Quite a few. There's distortion of policies, particularly in health. There could be uptake of ineffective and dangerous medication or treatments, rejection of effective services. There could be perpetuated risky practices due to false understandings of something going on, and then mistreatment of health workers that affect both the health worker as well as the services they provide. And most importantly, mis and disinformation erodes trust and confidence in science and health systems, which can further cause harm to populations. I'm going to now dig into examples of real-world harms. But first, I wanted to share a quote from the Director General of the WHO. He said, and this was during the epidemic, the COVID-19 epidemic, we're not just fighting an epidemic, we're fighting an infodemic. Fake news spreads faster and more easily than this COVID-19 virus, and it's just as dangerous. So information plus epidemic equals infodemic, and people can get lost in finding their way to fact. So how can fake information or misinformation and disinformation cause real harm? For example, there were deadly cures for COVID-19. We saw this in 2020 where people were not trusting the vaccine, and so they turned to drinking various substances as a prevention measure. And here you'll see one of the bulletins that the WHO had to put out there to say, this is a fact, drinking methanol, ethanol, or bleach does not prevent or cure COVID-19 and can be extremely dangerous because people were doing this and dying. Another example is HIV or AIDS denialism, reducing access to treatment and care. So we saw this through the lens of South Africa's president, Thabo Mbeki. He had a significant impact on public health policy from between 1999 to 2008, where he was denying treatment to HIV and AIDS, and including antiretroviral treatment. treatment to AIDS patients. And there was a lot of sickness and death in South Africa due to this leadership. There's also examples of violence and fear mongering. And the example here is when Ebola struck West Africa, there were a lot of attacks on health workers because there was the perception that perhaps health workers brought death into communities when really they were just trying to help save people. And so health workers were really, really attacked, and it was a scary, scary time due to misinformation and disinformation around this. And again, as already stated, this can further erode community trust. An example of this is just times of uncertainty and conspiracy theories circulating around the HPV vaccine. There's currently, some low parental vaccine confidence in vaccinating their children for HPV. And the HPV vaccine is known to combat the virus that causes cervical cancer. And it's just unfortunate right now that we're still dealing with this lagging vaccine coverage rate because of perpetuated misinformation. And by understanding more of where misinformation comes from and how it spreads, you can each play a role in combating it. So why do we believe misinformation? For various reasons that you can read within the boxes. Specifically, misinformation is sticky. It sticks in our memory and can influence our thinking, even after receiving corrected information. There's many reasons for that. We're hardwired to believe rather than to doubt, especially when those beliefs reinforce what we already think. We tend to judge the accuracy of information based on how easy it is to remember or accept. And the more we hear something, the more familiar it is, and the likely we are to accept it as true. But by better understanding how and why information spreads, you can be better prepared to face it. I also wanted to share that while it's a global problem, false information may have nuances by local setting, and misinformation can be perpetuated by community members, just mouth-to-mouth information spreading. And misinformation disproportionately affects marginalized populations within low and middle income settings, which often have lower trust and exposure to official health information sources. So how do we counter misinformation? There's various ways grounded in evidence-based techniques of science denial. And so I'll walk you through it. It's really important, if anything, to just remember FLIC. It's the FLIC framework. So it's the top of this graphic, and it goes through the 5 main techniques of science denial: fake experts, logical fallacies, impossible expectations, cherry picking, and conspiracy theories. And once you learn these techniques of science denial, you can help spot it out in the wild when you're hearing it in person, and then remind yourself, hey, let me check those facts and maybe teach others in your community about that. It also will help with your interpersonal communication using empathy, but then also to course correct messaging and educate and train others. So let's dig into some of these primary tactics of science denial. So fake experts is when an unqualified person or institution presents themselves as a source of credible information. An individual may pretend to be an expert in a particular area, even though their expertise or training is in a totally different field. And an example here is if a PhD holding mathematician challenged the science behind vaccines. For L, logical fallacies, the arguments are for which the conclusion does not logically follow the premises. So that example is climate has changed naturally in the past, so what's happening now must be natural. But I think we all know climate change is not natural, so that's not true. For I, impossible expectations, these demand unrealistic standards of certainty before acting on the science. So the example here is that scientists did not even predict how COVID-19 pandemic would spread. So how can they know that vaccines are safe? Cherry picking, the first C, is carefully selecting data that appear to confirm one's position while ignoring the other data that contradicts that position. So for example, while there might be hundreds of other studies, someone is really harping on about the one study that says smoking does not cause lung cancer. Of course, that's not true. And then finally, conspiracy theories propose that events are the result of a plan carried out by a secret group of individuals intending harm. You can always spot conspiracy theories if the narrative suggests there's a group of people behind a secret plot to cause harm, or that there's particular individuals or groups who are to blame for everything. For example, COVID-19 was invented in a Canadian lab by secret society to assert global dominance. That is probably a conspiracy theory. So to wrap it up, key takeaways are that misinformation is more than having wrong information. It can cause real-world harm, especially for public health. Not all false information is the same. Some of the main types include misinformation, rumors, disinformation, and fake news, and it can be spread by all types of media or through conversation. And if you understand more about where false information comes from and how it's spread, you can be better prepared to combat it. So
Thank you. Thank you everyone for following up us in this video. We are just in time. So we just want to thank you all for being with us in this session today, this dialogue. It was amazing to have you all. It was amazing to have these conversations in the breakout rooms. So please, let's keep it up. Wait for our follow-up email and see you all next week.
Thank you,
everyone.